I'm back again, but on another account. So, hi everyone. I'm Dr. Mystery from the Brown Psychologist account, and I am here to tell you more about the Brown Therapist Network. Now, I'm just waiting for Ravi to request. So, you just need to request Ravi to join. And we'll get the conversation started. So I'll just get Ravi to request to join. Let me see if I can get to do it from here. Here we go. Should work now. Hello. Hi, Ravi. How are you?
Yeah, not too bad, thank you. Yourself?
I'm not bad. I'm a bit tired today. I feel like, when the energy levels just start to go. So I'm feeling a bit like that at the moment.
I think it's the weather that's having a little bit of an impact, isn't it?
Okay, so topic today is finding out about being a health psychologist.
Yeah.
And I'm so excited to have these conversations. So this is part of a number of conversations I'm going to be having over the next few days with different therapists who identify as South Asian, but telling us their journey and their career. So Ravi, I would love for you to tell people who've joined a little bit about yourself. What do you do? And we can then get into the nitty-gritty of the conversation.
Also, hi, I'm Dr. Ravi Gill. I am a chartered health psychologist, and that basically means that I get to do lots of fun things. Throughout my life, I've experimented in different areas. I've worked in the private sector, the NHS. So I've got a variety of different experience. Main areas of specialism, I'd say, are around mental health. So specifically around supporting people with sort of like depression, but also more recently I've gone into trauma support as well. So the last year and a half, the bulk of my career has been around trauma support. And what for me I found as a South Asian therapist is that there are now more and more people from our communities now coming forward for therapy. Whereas before I think there was a little bit of a barrier where there was misconception about what it actually means. And now people are forward and just coming out to seek help for their issues, which is great to see.
Yeah, it is, isn't it? It's really awesome. And so the whole point of the Brown Therapist Network is to showcase the amazing therapists that are out there globally doing this excellent work and bringing us together as a community to learn from each other and share knowledge. So that's essentially what we will be launching on the 1st of June. So if you are a therapist or you're an aspiring therapist and you identify as being South Asian, please do join, and more details will follow on how to join. Anyway, let's get this conversation started. So I'm a clinical psychologist, so I can talk about clinical psychology quite easily.
Yes.
But for many people who don't know what a health psychologist is, how do we even start to have this conversation? I mean, what is the training route of a health psychologist?
Trained via the BPS traditional route, which involves 2 stages of training. The first stage was a BPS accredited, so by British Society accredited masters in health psychology. And the second part of it, which is the stage 2, is the professional doctorate in health psychology. So I completed that route. There is also an independent route where you don't have to go to a university establishment. You can build up your portfolio to be independently, but you still has to go through the BPS. So I chose the BPS route. For me, I found that was the best route for me. Thing, it depends on time, your level of commitment. If you've got a lot of like personal things going on in terms of like work life, home life, then perhaps the independent or a part-time route is an option. But for me, I found it best just to kind of soldier through and get both of them done.
Yeah. So, I mean, I'm assuming you did your undergraduate degree in psychology. That's the first thing.
Yeah.
What was it that at that point, once you'd done your undergraduate degree, did you sort of decide to say, actually, okay, right now I'm going to go and study this health psychology? What was it?
Health. So obviously when we were learning, so in the undergraduate, we learn about the basics of all the different specialisms that are available in terms of what you can go on to. And clinical was obviously a first choice, but it was a case of being realistic in terms of the wait lists. There is rejections before there is acceptance going into the clinical route. I think the NHS this was like 3 years at the time, because there are obviously NHS placements attached to clinical psychology, where health they're not. I was thinking, actually, what is the other most favourable option for me? Health was something that did appeal to me. I was working in a time, so I'd had a lot of experience in terms of dealing with minor ailments just over the counter, sort of like giving basic advice just over the counter. And so that exposure to like the health environment, I was quite comfortable with, I was familiar with. And then I thought, actually, how can I use my undergraduate degree and expand on that in health psychology? Well, that's where the journey started for me.
Wow, okay. So tell us a bit about what you were learning on your health psychology. Was it the masters you did first, right? Yeah. So tell us a bit about that.
More about learning about long-term conditions, so things like cardiac conditions, diabetes, and how health psychology theories and models could be applied for the long-term management of those conditions. This is the NHS smoking cessation clinic that just started, and that's very much a health psychology driven sort of like intervention in terms of the way the model was created. There was a lot of initiatives around that time using psychology underpinnings and theoretical perspectives, which we were then demonstrating within the NHS. So for me, it was a chance to really basically be involved with that. And that for me was really exciting, because I could physically see it happening around me, whereas before I perhaps wasn't aware of it. It's almost kind of like, you know, this person does this, but until you actually see that job being done, being seen live, it's kind of like, oh, okay, I think I could do this. And it intrigued me even more.
That's really interesting, isn't it? So in many ways, health psychology is more about sort of prevention rather than sort of on the other end of the spectrum, which is what clinical psychology often is more about treatment, isn't it? So when by the time you've realized you're struggling with your mental health, then you go and see a clinical psychologist or a counseling psychologist. But actually what you're saying is that you're thinking way before that point. You know, you're trying to get them to not engage in, sorry, there you go, just ran off then for some reason. It keeps closing. So you started off with that, and then so was it just the masters you had to do, or?
Yeah, so with the masters I had to do that, but there was a placement attached to the masters program, which is what really intrigued me as well. And I had the opportunity to work within NHS community services. So I worked within like a London borough, and what we did within that service was that anybody that had hit like a certain number on a BMI, so if they were pre-diabetes or pre-cardiac, or if there were concerns about weight, if they were borderline within like a BMI, they would come into these classes where they would get psychoeducation, nutrition, exercise, how to manage their diet, how to just live that healthier lifestyle and make those choices. And I would work with them to produce SMART goals and work alongside them for like a 6-week program or an 8-week program, whatever would work for them. Work with the dietitian and the nutritionist. They'd attend weekly weigh-in clinic where have like an opportunity to talk to a psychologist to say, I'm struggling with my motivation a little bit, I've tried this didn't work, or this worked really well for me, how can I continue this? Just those little check-ins to really help them to continue to maintain that behavior. And that really for me was the pivotal turning point of, I could do this long term.
That's so interesting, you know, sort of seeing it from the other side, really. And you know, when you think about health, like mental health, we know how interlinked it is with our bodies. Like it's literally like just all one, right? So from your perspective, how now do you sort of, now that you said you're kind of in the trauma space, you're doing more kind of therapy work, how are you sort of putting it all together based on your health psychology knowledge?
Experience, it's almost kind of like it's never not needed. I can always still apply it, because it does provide that foundation base for me to be able to build upon. And a lot of the trauma presentation I see, a lot of like people that I speak to are unable to explain. They just know that something doesn't feel right. And I say, well, how does it feel within your body? Are your shoulders quite tense? Are you holding it within your tummy? You know, does your headache, does your head hurt a lot? Are you like clenching your jaw? And when we go through those points, they're like, yeah, actually I am. That's when I say, you know, your body is holding on to it, and you can recognize it other symptoms rather than the mental health side.
That is so amazing. So, you know, in many ways, your route is quite different from a traditional sort of clinical psychology route that we look at sort of mental health as what we class as psychopathology, right? We just pathologize it. We see it as an illness. Yeah, it's very much aligned to the medical model. And I now, having kind of been in this field, I feel like I'm stepping away from it.
Yeah.
And really, I feel like the whole shift of the health and well-being space is around that. It's around that integration of the mind and the body, and for us to be a bit more proactive in encouraging wellness behaviors. I mean, we're seeing this all around on social media everywhere we go about promoting good nutrition.
The movement towards a holistic model of health. And I think that's going to be the drive going forward as well.
Yes. We are thinking about prevention rather than cure per se. Yeah, absolutely. Yeah. So tell us a bit about, you know, your experiences working as a South Asian health psychologist and what that has been like for you.
So when I was working within the NHS service, I actually worked as an assistant psychologist in the dementia service. And that, for me, that wasn't as at an advantage because I was South Asian. There were a lot of people within the community, as in our South Asian community, that were being diagnosed with dementia.
Oh, right.
So my role involved translation for one, but being able to explain to them what was happening to them was a massive part of it, or for them to even go through to the assessment process. You know, the doctors are saying, I've got dementia. What does that even mean?
Yeah.
So I provided that little bit of a bridging gap for them to be able to understand what was actually happening to them. We delivered a CBT for carers course, and, you know, family members were invited to join, and they're like, but what does this actually mean? If let's say your children have moved away and the elderly generation are left at home, they're trying to navigate the health system. They've got language barriers. Their health literacy isn't the same. So what does this all mean? And a lot of people will miss their appointments. They won't take their medication because they're not sure. So it was for me, an opportunity for me to just explore that and help them kind of educate themselves basically about what's happening.
Yeah, it's so important, isn't it? We forget that there is often this gap of knowledge that often our elders do experience, and probably a level of sort of, lack of understanding, maybe mistrust as well. That seems to be a big thing.
Denial, this doesn't happen to me. This is, you know, like not trusting the Western medicine kind of, which is quite prominent within the culture, and not sure what it actually means. So that's where that uncertainty sort of comes up from.
Yeah, makes tons of sense, doesn't it? And actually, what you're essentially doing is bridging that gap, trying your best to bridge that gap.
Yeah.
And it's not the easiest job.
Assessments and things as well, because obviously where the health literacy comes in, if you were asking them, you know, take 7 away from 100, well, you have to look at their level of literacy. If they've never been to school, how are they expected to be able to answer those questions and things? So being able to navigate, you know, like, well, if you went to the shop, what 5 things would you buy? And, you know, doing things like that to make change. We'll make sure that we can capture the same information to be able to complete that assessment.
Yeah, gosh, it's fascinating, isn't it? So the work that you do now has somewhat changed in that you're kind of working more within the mental health realm. How did you sort of go from health kind of like health prevention, health psychology over to this more kind of mental health route? Yeah, how did you get there?
When I started the stage 2 doctorate, one of the requirements is that you are in a full-time job where you're able to complete the competencies that are necessary to, you know, the actual doctorate program. So you have to build up a portfolio of evidence. And the opportunity to be a psychologist working within a dual diagnosis supported accommodation. So this is where there were individuals with a mental health condition, but a physical health diagnosis as well. So let's say there would be, you know, paranoid schizophrenia, and they were also suffering with bipolar disorder. Paranoid schizophrenia and diabetes, or they had high cholesterol levels associated with bipolar.
Yeah.
And that. So again, knowing that the impact that mental health medication has on your physical health anyway, so it will increase your sugar, you know, it will increase your appetite, it will make you put on weight. How do you then manage somebody that's already got a pre-existing condition? And with mental health concerns, you know, this is where it's like the more intense, where people have been hospitalized because of their mental health. How then work with them to manage that? I would be responsible for holding the psychoeducation, working with the support staff to navigate, to them to navigate their own way through life.
Gosh, yeah. I remember as an assistant actually seeing how that looks. Yeah, absolutely. It's really tough, isn't it? Like, you know, for anybody who just genuinely has a physical health or chronic condition, that's
Yeah.
hard enough to do. But then having to deal with a mental health condition
On top
on
of it.
top of that, whoa, that's intense.
Yeah. So there was a patient, for example, that I worked with, and he had psychosis and diabetes. But what would happen was he was asymptomatic the entire way through. But as soon as his blood sugars dropped, his psychotic presentation became much more apparent. So he would begin to hallucinate, and you know the things that he was saying, it was very much more on the psychotic presentation. But once his sugar levels were balanced, it's completely, well, normal to some extent.
Wow. That is really interesting. Again, it's that whole mind body link thing.
Yeah.
It's just so like, yeah. And I think we're still very much in the infancy of really trying to understand it and unpick it. So, you know, that's fantastic work. So I guess what I'm also interested about is the route that obviously you did a master's, then you did the doctorate. What is the process of getting onto both those courses after your undergrad?
So you basically just apply to universities, and there are lots of, you know, places that offer the course. The way that I did it was I went directly through the BS website, so the British Society website, to be able to see the list of courses that were accredited by them for being equivalent to stage 2. And I just continued and applied accordingly. Obviously, you have to submit like a research proposal, how you wish to expand, you know, your research within the field and things like that as well.
Awesome. And are they kind of postgraduate qualifications that you have to pay for, so self-funded? Yeah.
There are opportunities if you have like a clinical placement where perhaps your job might subsidize the cost and you have to continue sort of working with them. That is also an option, but I personally self-funded. And in the NHS there were clinical placements and things available. That's also an option, but for me, just self-funding it was the easiest route for me to be able to complete.
So the master's is 1 year, and then the doctorate is how long?
Well, it's written as 4, but I completed mine in 3.
Okay.
Yeah.
How did you manage to do that?
I lost 3 years of my life, but it was worth it.
So quite intense then.
Very intense, because you have to have a full-time job to be able to complete the competencies. So working in the support unit was my Friday 9 to 5. On top of that, to complete the competencies, if there were training or like teaching and training opportunities, I would also volunteer and do those. If there was the clinical placement, that would be 1 or 2 days a week for the 6 weeks. It was juggling a lot of different balls at that particular time just to get through and finish.
Wow.
But one of those things that if I didn't do that now, I don't think I would have done it. So for me, it was a personal achievement to let's just get it done.
Yeah. I remember that too well.
Yeah.
The clinical training is just as intense, you know. It's just all set out for you in many ways. It's done, but you still have to jump through so many hoops.
And explain it to people of like, what's it like? And you're like, do you know what? I can't even put it into words because I've closed that bit off. I don't know.
Yeah, we've switched off from that. That was a long time ago when I had less grey hair. Yeah.
But all of my like doctoral portfolios are still there, and I'm like, don't want to look at them.
Don't want to look at it. Yeah. So where did you do your training then? Where was the?
I did mine at London Metropolitan University. So when I was there, it was the stage 1. As I was finishing, they had just been validated to start the stage 2. So I just continued with the same because I knew the lecturers. It was a familiar working environment, so I just continued my education there.
And so, you know, for people who haven't considered health psychology as a sort of training route, what would you say to people who, you know, because the problem is, right, that often when you, but like you, like me, right, we're doing our undergrad and all you hear is clinical psychology. It's the biggest the biggest profession that we know about psychologists, you know, in terms of within the NHS anyway. So what would you say to people who are like, oh, right, well, what are the benefits of me doing health psychology as a postgraduate qualification?
I would say that it's just an opportunity to work in a variety of different working environments. With clinical, it's very much going to go into the mental health space or with the physical health space in terms of dealing with the diagnosis. But in order to be on the other side, just as you mentioned, on the preventative side, I think that's really exciting to actually see the happening. You know, when we deliver the psychoeducation classes for like the diabetes service, where people were, the level of, you know, information they now have to manage their own health, it's just amazing to see. And you can say that, you know what, I'm able to manage your health better, but it's added how many years to your life. So from that perspective, you know, we are an aging population, we do need to look after ourselves a lot better because we're working longer, everything else factors in. Who's going to look after you but you?
Exactly. And this is the whole push that we're trying to go for, right? We want prevention. We want you to get to a place where you're healthy, so you're not needing to see, you know, professionals later down the line for things that actually could have been helped beforehand. Yeah.
That's the driving force with mental health now as well, where such an emphasis has been placed on self-care and taking the time to regularly check in with yourselves, do mindfulness, whatever it is, you know, make sure that you do check in with your own mental health first to be able to see any red flags, and make sure that you get the support as and when needed rather than it being too late.
Yeah, yeah. And I think that especially with COVID, I feel like that people have really started to look at themselves.
Yeah, take it seriously as well. It's an opportunity for them to just be, you know, by themselves and realize, hang on a minute, I never used to feel like this, what's going on? And perhaps just give them the confidence to perhaps now explore it.
Yeah. And I think the other thing I guess I want to kind of point out is that we are responsible for our health.
100%.
Yeah. And I think that with the help of people who have done health psychology, health psychologists, we can get to those results much quicker than without that help. Like you said, you know, to really understand motivation, to really understand the mechanisms that drive motivation, and all those aspects of health psychology that, you know, there's tons, isn't there? It's constantly being thrown at us in many different ways. If we could understand that a bit better, we need to fund more health psychologists. Simple as that, right?
Psychology isn't funded. Or like I said, if you're working for a company and they're able to subsidize the cost, that's brilliant. Apart from that,
yeah.
But I think the clinical ones are over, you know, for every one place there's like 100 applicants.
Yeah, oversubscribed simply because it's funded.
Yeah.
And I guess that just goes to show where the emphasis is. The emphasis is still on the kind of cure aspect, the treatment aspect, rather than the prevention.
That's right.
I really do hope that things do change, but you know, who knows? It's one of those things.
Exactly. Yeah.
So for anybody who's listening, if anybody's got a question or whatever about health psychology, where can people find you?
Just find me on my Instagram page. I'm happy to answer DMs when it comes to sort of like career choices and like that. More than happy. Answer those questions around it. And just, you know, unfortunately, I don't know of any places that offer assistant psychologist jobs. I can just say, perhaps look here. But what I would suggest, don't always go down the traditional NHS route, wider outside the box. There are a lot of community-based services that offer the same, even though it's not NHS or not, you know, through the clinical NHS route, but you get that level of experience through those services. So please make sure that you just think up a bit.
Yeah, and I think it's really difficult, isn't it? Because when we think about psychologists, we just assume hospitals, mental health, you know, really kind of narrow way of thinking about it. But actually, if we start to get people to think about, like you said, being a bit more broad, a bit more creative in the way that we look at trying to get this work experience, it's going to be vital for us.
100%, yes.
So one of my last questions I have for you is around this idea of South Asian mental health and kind of wellness, because you're looking at, obviously, as a health psychologist, prevention. And what are you seeing at the moment in terms of, you know, from your position as a South Asian therapist and the landscape of South Asian mental health?
I think with the elder generation, my biggest don't even want to say annoyance, it's just, we all know that it's there, but I would really like to challenge the elders of our community to say, what is it about the South Asian community that means that they're exempt from getting mental health? you know, that doesn't happen to us. Well, what is it about you that makes you different from anybody else to get it? You know, we all suffer with it at some point. You know, even as therapists, we have to go through supervision and things like that to manage our own cases. So what is it about this elder group that say that they're not exempt? I think the younger generation coming forward are definitely not taking that approach because they're having to experience it themselves and they're actively working through it. But there is still, you know, the underlying expectations of that happen to us that a lot of people are fighting. I think being a South Asian therapist, one of the biggest challenges I first faced was that I wasn't getting many South Asian clients. And I think that was for the reason that perhaps they might know a wider family, the area in which you work, and is that too close to home, and, you know, navigating that particular part of it. But again, I think since COVID, all of that is out the window. And if anything, I've actually seen more South Asian people in therapy in the last 18 months than I have in the last 5 years.
Yeah.
Slowly changing, the message is changing.
Yeah, it's fantastic in many ways, but also quite like, you know, it's quite sad in many ways to see, you know, people are suffering. And obviously we're not exempt, like you said, we're not. We're all going to experience highs and lows. We're going to all experience different things.
Trauma that we've all been carrying, we know that it exists. Why is nobody challenging that, you know? And now it's the younger generation coming forward. They're now seeing it as trauma rather than, oh, it was fine, I just grew up like this. And, you know, it's like, no, you know, there's something wider going on here, and we're now having the guts to perhaps face up to the realities of that and challenge it in some way.
But I think also not just within the South Asian community, I feel like this is broader. You know, you think about like the campaigns like ITV, Let's Get Britain Talking. We wouldn't have seen that 10, 15 years ago. It just wouldn't have been accepted.
Forward to say they've suffered mental health themselves, that you would never have seen as such a taboo subject.
Isn't it? Exactly. And I think that all of this movement is making way for us to start to feel a little bit more safer, to be honest with ourselves and be a bit more vulnerable. It's so hard to do that. And, you know, for anybody who does take that step to go and get the support and help they need, you are not weak. You are brave. You are so brave, you know.
Go to therapy to say, can we talk about this, rather than the person hiding to say, there's nothing wrong, I'm fine.
Yeah. And I think it's that whole idea of like, you know, that if we think about what our parents, grandparents, great-grandparents went through, they had to just grit their teeth and get through some really tough times, you know.
Isn't it? Migrating to another country, adjusting here, what does that actually mean, and navigating their lives around it. Now, because we're second, third, fourth generation, it has a different context.
Absolutely. And I think that, you know, what we're doing as our generation and the generations after us are just really not afraid and unapologetically themselves, you know. They're willing to be vulnerable, which is so powerful.
Yeah, definitely.
Okay, so I don't know if I've got any more questions. I think I'm all questioned out. Is there anything you wanted to share while we're here?
No, I just think if anybody does have any questions or they think of anything later, please feel free to DM yourself or DM me. I'm happy to answer any questions in terms of the health psychology route and things. And yeah, it'll be interesting to see what the Brown Therapist Network brings.
Yeah, we're so excited. So just to remind people who might have joined a little bit later on, that we are launching the Brown Therapist Network on the 1st of June. Doors will be open from then. It's a community where you know, people like me and Ravi and, you know, people who are doing this work are going to be meeting together in a space away from social media, so you won't have that stress, where we'll be talking about this stuff, talking about health profession, you know, health prevention, even talking about the kind of link between the mind and body. And, you know, isn't it interesting how actually South Asians have higher risk of cardiovascular disease and diabetes? What's that about? You know, do we understand that? Do we understand that from a position of kind of mental health as well? Is there something, you know, are there links between how stress is?
Things can be done, yeah.
Absolutely. So, you know, when you think about like our parents and our grandparents, more than likely they're going to have, you know, a mixture of you know, physical health conditions. And you know how you were saying, Ravi, like that, oh well, they don't believe it happens to them. Maybe it does, but it just it presents in a very different way.
Yeah, denial. Oh, it happens, sometimes we just, yeah, it's too much sugar. It's more than that.
Yeah, exactly. So how does actually stress manifest in our
Yeah,
bodies? Do we really understand that? And do our families really understand how it, what does chronic stress do to the body over time, and what can we do to prevent that? Because I think a lot of the issues that I find within our community is that it's that kind of idea of, well, it's in God's hands,
yeah,
or well, it's genetic, so I'm bound to get it.
yeah.
I'm bound to get diabetes. And I'm thinking to myself,
Oh.
you can change that
Yeah.
you have the power.
Don't
you
be
know
willing to accept the diagnosis before you've got it. Change it. Change it. The
Absolutely.
person says, I didn't get it.
Absolutely. And also this culture around, taking medication to manage a condition is okay.
Yeah.
No, and be on that medication for the
Yes.
rest of your life.
Yeah, the phobia around Western medicine is very high.
Yeah. And it's just fascinating, isn't it? Just the
Yeah,
way that we are now flipping things on its head.
definitely. Yeah.
Well, thank you so much. I really, really enjoyed chatting to you. And, I hope that we continue to have discussions like this, because we have to come together and work together and learn. I feel like that there's so much that we can learn from each other, because we've had different training and different
Of course.
experiences.
Yeah, brilliant. Thank you so much for having me.
No problems. Well, thank you everyone who joined, and we'll speak to you. I'll be on tomorrow. I'll let you know more about that in my stories.
Thank you.
Take
Bye.
care then.
Bye.
Bye.